Hello and welcome back. If you're just tuning in, you're watching the Arthritis Show, a global information source dedicated to patients with arthritis and sports injuries. Joining us today in our studio is Dr. Ahuva Gamliel. Hi, Doc. How are you?
Hi, nice to meet you.
Great to have you here.
Thank you.
Doc, for people out there who don't know what naturopathic physician is, will you explain that?
Absolutely. Naturopathic medicine unites state-of-the-art procedures with ancient healing methods. We treat everything that a person would go to a conventional doctor to treat, and we emphasize holistic modalities such as nutrition, supplements, exercise, and lifestyle factors.
Fantastic. Now, we put a video together that your video was done in your office, and they filmed you while you were doing some of these holistic medicine shots. Let's go to that video. So do you see a lot of arthritis in your office?
Absolutely. Pain is one of the most prevalent conditions that people come to seek acupuncture for. Pain of all the joints, back, knee, neck especially.
Okay. Now, it showed in the video that you were examining, you were injecting the knee at this point?
Yes.
Possibly?
I'm doing actually 2 treatments on this patient. I'm demonstrating acupuncture in one knee and homeopathic injection therapy in the other knee.
Okay. And you're going to go inside the joint?
Yes, into the acupoints that are right on the joint. And what I'm injecting here is a homeopathic solution called Zeal. Zeal is an anti-inflammatory analgesic, which is for chronic inflammation. The same company makes another formula called Traumeal, which is for acute inflammation.
Okay. And this person is suffering from osteoarthritis for many years, or
yes,
acute?
She has joint pain in the elbow, shoulder, knee, all over, and she's had much success with acupuncture. She had tennis elbow, which is another type of inflammation, and it was greatly relieved after just 2 treatments.
With the Zeal?
With just acupuncture. Yeah, okay. And this was actually the first time that we did the Zeal in her knee, which is in the PDR.
No, you're doing acupuncture on it.
On the other knee.
You can see that on the
yes.
On the monitor up there. So you like to go 5 points for acupuncture on the knee, or?
It depends on where the pain is, but I like to treat all around the knee. But if the person's pain is more medial, then I focus on the medial side. But there's also distal points on the hands and the feet that affect the joints, even that are not directly on the affected joint.
Okay. All right, perfect. And how often can a patient do the Zeal injections?
Well, it depends on how badly inflamed they are, but usually it's done once or twice a week.
Okay, okay, perfect. Now, for the look, you're just about. Is that an acupuncture point, or is it you're treating the arthritis in the finger?
Okay, so the point here, which I want to demonstrate here in the studio, is called the panacea point, and it's actually for pain anywhere in the body. It's used even for dental analgesia. It's used for surgery. It can be related to arthritis or not related to arthritis. It can even be massaged if a person has a headache.
And that will help the area.
Yes.
All right. Now, in our studios today, Doc is going to do a demonstration. He's going to put a needle on me. This is for people out there who are needle shy, who think that it's painful. Mm-hmm. But the acupuncture is very, very subtle, right?
Very subtle.
Very subtle. Okay. Here you go.
So this is an acupuncture needle. As you can see, it's in a case, and I'm going to open it. They are sterile. They're only used on one patient, and then they're thrown away. They're not autoclaved and reused. And then there's a point here on the hand, which, as we spoke about, is good for pain. So we press it in just very gently with the guide tube, and that's it.
There you go.
Did you feel anything?
No, very little. Maybe like a insect bite, the most.
Exactly. People describe it as a mosquito bite.
At this point, you don't need to twist it, right? I've seen that. What is that twisting about?
When people twist the needle, it's because they're getting chi. They're activating the person's vitality, their own immune force. Okay.
Let's take a moment and speak about chi while this needle here. What is the chi for the audience out there, please?
Chi is the person's own vital force, which is what we're stimulating that's assisting in the healing process.
Okay, and the chi is like, is it something that is all around us? Is it something that it cannot be measured, right?
Correct. It cannot be located or pinpointed. It might be around us in our aura. It could also be inside us, some kind of combination of the two.
It's just like electricity. It's there. We know it's there. You cannot visualize actual electricity, but You know the energy is there.
Right.
Well, how long do you leave this needle in for?
Usually for half an hour.
Okay. Well, we're gonna at this point we're gonna take a break, Doc, and I wanted to thank you for coming.